On behalf of the Public Health Services Council of Ohio and the Ohio Public Health Institute, I'm pleased to welcome you to this Ohio Accreditation Learning Community webinar on crafting comprehensive AI policies for public health, why they matter, and how to create one. I serve as the Executive Director of the Public Health Services Council of Ohio, which is a regional council of governments made up of local boards of health. Our mission is to offer solutions for today's public health needs, including expanding health departments' capacity to provide foundational public health services. FISCO works on behalf of OPHI to coordinate the Ohio Accreditation Learning Community's activities that benefit health departments across the state, including webinars like this one. If you can advance the slide, please, Nebu. So at our ALC training and networking day last month, Nebu Kolenchery of Flourish and Thrive Labs provided a very popular plenary session titled Using AI Responsibly in the Accreditation Journey. 97% of the evaluation survey respondents strongly agreed that they learned new and or helpful information in this session. Nebu noted that while many health department staff may be using personal AI accounts in their job, few agencies actually have a policy that guides staff in doing this in a manner that is safe, responsible, and compliant with privacy, confidentiality, and HIPAA requirements, let alone in a way that meets public records requirements. Today's session is intended to help you address this gap in your health department. Next slide. It builds well upon several management moment columns appearing in recent editions of the Journal of Public Health Management and Practice. In the September-October 2025 edition, Drs. Edward Baker and David Ross issued a call to action for public health leaders to take tangible steps to move from merely exploring AI as a futuristic experiment to actually using it knowledgeably and confidently as a practical tool for enhancing their daily practice. They noted that AI could help in three key areas: to improve public health communications, to enhance organizational efficiency, and to implement innovative approaches to public health practice that could improve data acquisition, integration, and analysis. Then in the November-December edition, John Auerbach joined with Drs. Ross and Baker to note that regardless of a health department's size or funding, the time has come for, quote, every public health agency to develop a basic plan for integrating AI into its practice, end of quote. The authors acknowledge AI will not solve all the challenges facing public health, as it is not magic. But they note AI is a powerful tool that can help us serve our communities more effectively, efficiently, and equitably if approached with humility, transparency, and strategy. AI can become one of the most valuable tools in our evolving public health toolkit. Today's webinar does exactly this by helping us examine why and how to create comprehensive AI policies for our health departments. I'll now turn the webinar over to our public health colleagues at Flourish and Thrive Labs, specifically Nebu Kolenchery.
Thanks, Ann.
You're welcome.
Hi, folks. Hi, folks. So my name is Nebu Kolenchery. I love Ann's framing of approaching AI with humility, transparency, and respect. That's absolutely right, and that's something that we advocate for as well. So a little bit about me. I live in St. Louis, Missouri. I'm originally from the Chicago suburbs in Arlington Heights. I currently serve as the Chief Revenue Officer for Flourish and Thrive Labs. And I'll tell you more about us in a second. So prior to my current role, I was actually the Director for Communicable Disease Response at the St. Louis County Department of Public Health. And prior to that, I was at CDC and DOD in a contractor role. But I also have a personal connection to Ohio, and that is that I married a girl from Dublin near the Columbus area. So I was really grateful to be a part of the Accreditation Learning Community event last month, and it was such a joy to meet and speak with all of you on a what we think is a very important topic in public health today. So we work for a company called Flourish and Thrive Labs, and we are a consulting firm that works with state and local health departments on data modernization problems. We are all for public health by public health, and what we mean is that all our staff are former health department employees because we feel that public health is kind of unique, and we need that space and that knowledge to serve public health departments. And that lived experience allows us to support you all as you navigate budget constraints, political realities, your regulatory framework, et cetera. In the last couple of years, all our energy really has been focused on how should and how can public health embrace AI the way that our other sort of industry partners have. And at its core, we think thoughtfully applying AI tools to routine tasks in particular can create space for public health professionals to focus their expertise on where it matters most, which is improving community health outcomes. So our work largely now revolves around a tool called PH360, which is a safe and secure platform for health departments to access AI. So if you have any questions about that, you're welcome to email me or go to our website. But today, what we're going to be talking about is um, is AI use in public health. So here's how I envision our time today. So we're gonna start by talking about um, what AI is, and then talk about then what how in our experience very quickly public health departments are using AI, and then we are going to I'm sorry. We're going to discuss sort of the why an AI policy is necessary, and then talk about the sections of an AI policy. But the real meat and potatoes of what I'm hoping we accomplish today is to give you all a step-by-step guidance of what your AI policy should have, and then try to work through um, what 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 that process of building it looks like. And the key takeaway I'm hoping that you have is this, is that yes, the policy document and the words on it are important, but what it is really, what we really see value in is all of you within your health departments, within your leadership teams, wrestling with the questions around how AI should and could be used in public health. And that process of discussion and discernment, like that is of far more value than anything else, because it forces you to reckon with the potential and the sort of what could go wrong with these tools. And our hope is that you walk away with both a document. We'll be sending out a document shortly for you to work toward each sections of that policy. And then what you'll see is my colleague Brett and I will pretend to have part of that conversation. We'll then break out into small groups. They're not going to be small because there's over 100 people on this call, which is great. So there's going to be small groups for y'all to engage with that conversation in one of those sections, and then we'll have questions. So at any point, please interrupt me for questions. I'll do my best to monitor the chat. You're also welcome to come off and mute um, and ask me right away. So before we jump in, any questions? All right. So I think it's important to talk about AI in um, in context. So if any of you have seen like the Benedict Cumberbatch movie, The Imitation Game, this kind of in the Alan Turing proposed a study of a Turing test, which essentially was can machines think? Was sort of the question he was trying to ask. And then in 1965, MIT came out with the idea of like an ELIZA conversational program, which was really the first chatbot, and it drove crazy amounts of interest in the AI space. And then in the 70s, we went through something called the AI winter, which is when there was this huge hype cycle, honestly similar to what we're seeing today, that didn't materialize into what they thought was going to happen. And then in the 90s, there was, if any of y'all remember, Deep Blue, which was a chess computer developed by IBM that defeated Garry Kasparov, who was a famous chess player at the time. And it beat Garry Kasparov, which was a crazy thing. And then now fast forward to, I love chess, so any chess.com on your phone will is better than Magnus Carlsen right now, which sort of goes to show how far these tools have come today. All right, so then fast forward in 2011, IBM Watson, which was that the Sunshine kind of computer on Jeopardy, defeated two former Jeopardy champions, and then what we now know today, which is in 2020, OpenAI released ChatGPT. So the reason I bring this up is that we need to see AI as a spectrum. We are part of a journey that has been going on for at least 50 years, probably closer to 80 or 90. So what actually is AI? In our last conversation together that some of you attended, people found the definitions really helpful. So let's come up with a shared definition today. And what we're proposing is that for the purposes of this conversation, let's define AI as technology that enables machines to perform tasks that typically require human intelligence. So what does that mean? So that could be, recognizing objects. It could be speech recognition, so understanding spoken language, some decision-making things, so, analyzing the options and making choices about data. And then language translation is very common. I noticed many of y'all have AI note-taking tools that were invited to this meeting, all of that, right? But AI really is an umbrella term, and there's a two or three things that I want to talk through that we come up with that shared definition together. So the first is what I'm going to call traditional AI or discriminative AI, and this is sort of the oldest type of AI. And what it is it follows explicit rules that humans program in. So if this happens, then do that. So some of you might have those smart thermostats. So like if the temperature is above 60 degrees, then turn on or turn off the AC, or 70 degrees, or whatever have you. Or even these note-taking tools, right? They're taking my voice, comparing it to data that they have around the human voice, and translating that into English. And that is discriminative AI. Then there's generative AI, which is really what's getting people's attention these days. And generative AI doesn't just sort of analyze or classify things, it generates new content based on the data that it's trained on. So that could be text, that could be images, that could be code, and now it's music and really even video in the last couple of months. So ChatGPT is generative AI, or DALL-E for images. And the Patricia's AI assistant, Otter, that would be sort of discriminative AI. And so this type of AI is what's getting a lot of attention, and it's most relative to our work today. And then there is large language models. So large language models, or LLMs. So LLMs are a specific type of generative AI that's been trained on massive amounts of text. So we're talking billions of words from the entire internet. And so that is the sort of tools that are powering the chatbots that we use today. So traditional AI, generative AI, LLMs. So now on to public health. So we this past spring had about 50 conversations with public health teams across the country, because we were interested in how public health teams are using AI. And here's what we found. So they're using AI, whether or not there's an official policy. The tool of choice is what we're calling consumer grade AI. So consumer grade AI is things like ChatGPT, or creating your own Claude account, or anyway, non-specialized tools that are accessible to anybody. And then the last thing we learned was that there are concerns across our industry around accuracy, privacy, and equity. And environmental concerns, I'm going to call them the equity bucket, because we did hear that a couple of times. And what's really notable, I want to come back to that first point, which is that most organizations that we talked to at that time did not have AI policies. In a few minutes, I'm going to poll y'all to see who has one in this room. But regardless of that policy, people were using it. And that's why this conversation is so important. And at F&T Labs, we think folks should take a harm reduction approach to AI, which is, and what I mean by that is, give our teams and give our staff safe pathways to use it. Now, will they use it, or outside those pathways? I don't know, maybe, but we have to mitigate the risk, and we have to define that risk for ourselves, and then take action to mitigate that risk, just like we would do for a public health problem. So, um, and in public health, AI can be good for many things. So research synthesis, pattern recognition, drafting content. Many people might be using it for emails. You could be using it for research support, and that's great. We would recommend thinking broader than that. Like, so how can AI be used in your workflow, right? And so that could be like that could be not just writing emails, but maybe writing um, automating the writing of reports, using it to save time, etc. On the other hand, there's many things that AI doesn't do well, largely around things that require human judgment. It it is getting better every day, but there are people that are using it for things that are good. There are using people that we don't recommend. But as your departments, as your entities, as your organizations, you have to make that decision for yourself. So the biggest reason for I'm going to call it regulating how AI is used is that they can be wrong, right? And so here's a prime example. We work a lot with supporting health departments with their food code. So we ask the same question to ChatGPT, Claude, and Gemini around what are the pasteurized juice requirements um, for the Wisconsin Food Code. And it's a, depending on the tool, some of it is right, some of it is wrong. And the large reason for that is there's multiple different versions of the food code. There's multiple different years of the food code. And state by state, it's different. Each state could have its own interpretive memos. There's a whole variety of reasons why consumer grade tools can get things wrong. So the other important thing in public health is this. Uh, it's that we have a lot of regulatory compliance that is important. So this actually is a very helpful uh, resource that was released last week from the Network for Public Health Law, and they wrote a piece or fact sheet on Gen AI and legal considerations and risks for health departments. Um, I don't have a link to this, but I will put it in the chat later. But it what it says is that like all health departments should be aware that the use of Gen AI, including prompts and chats, may create a record subject to public disclosure. And may is very intentional because it differs state by state. And again, these laws are being written because this is a relatively new tool and this is relatively new technology that we're going to engage with. So what might that mean for y'all? It's that we need to prep for the eventual reality that there will be policy around this at a national level or at your state level, et cetera, and we can't afford to be left behind with these tools. So the way to get ahead of that, I would argue, is starting now and engaging with these questions. So um, so really, our kind of thesis is that AI tools in public health must be A, accurate, B, support regulatory compliance, and C, ensure records retention, whether or not you have that in your policy. Which brings us to policy. So, what is an AI policy? Really, at its core, an AI policy is a guardrail for your organization. It's meant to protect your organization, it's meant to protect your staff, it's meant to promote fairness and consistency in the application of AI across your organization. An AI policy ideally should help make expectations clear. It should define, here's an acceptable use, here's an unacceptable use, here are the acceptable tools, here's the unacceptable tools. But really, what we're saying is approach this like too often in public health we approach policy from the perspective of saying no. What we're suggesting is you explore AI policies from the perspective of possibility. Like, how can we work together to create safe lanes for innovation, right? Like highway guardrails that don't stop traffic, but they prevent crashes. They protect your staff, but still allows them to get to where they need to go. So while we're on this topic, then let's kind of ask. I'm going to put a poll in your chat that asks whether or not you have an AI policy at your organization. I'd love to know. Um, it should be at in your screen. I would love to know what people are saying. All right. Okay, about half of you responded so far, and 10% have a policy, and about 90% um, do not, and some people have guidance. This is phenomenal. Thank you, thank you, thank you. So uh, really, like, why should you have one? Because you should use AI to save you time on things that don't require your brain on your heart or your heart. And what I'm happy to talk more about that, but really your brain, it requires explicit thoughts and explicit experience that only you have. Your heart, it requires that human touch, that human judgment. So let's now talk about like what should be included in your AI policy. Okay. So at a very, very, very high level, these are the sections that should be included, which is scope. So scope is who should be using AI tools. Will the policy apply to all employees or specific departments or contractors? What constitutes an AI tool, and so that they understand, your staff understands um, what that's meant to be. The second is approval and access. So approval is this, and this today we're going to work through the approval part of it. So how should your department assess what tools are available? And then how should they give them access in terms of, training requirements? How often should staff be retrained? Should there be role-specific training? And really establishing a governance for the tool approval and access process within your organization. The next area to address at a high level is ethics and privacy. So ethics, both of the ethics is largely around bias and safeguards around like acceptable uses, non-acceptable uses, training your staff to recognize bias, or what does the human in the loop review look like? Is there ever a scenario where you would allow your community to immediately access an AI response in lieu of having one of your staff review it? What ethical guidelines should you allow your staff follow when using AI tools? Like, should they attribute the fact that they've used AI in their work? Um, and then around reporting and accountability, how will the agency monitor AI tool usage, and what processes should be in place for reporting this? Um, uh, Reporting concerns or incidents, and how do you review and approve that? Um, and then we've talked about training as part of access, and then approved uses. What is acceptable, what is not. All of these are sort of the key areas that we would recommend y'all work through. So Brett, can you resend that link that you shared earlier?
Done.
Thank you. All right, folks. So this is the document we're going to be working through together. If you access that, you'll see there's 12 sections. It's meant to be this like step-by-step guide for y'all to have conversations among you and your staff. And let's work through them together. So we're going to start with scope. But again, I want to reiterate that the purpose of this is for y'all to understand that like having this conversation is important. Our hope is that you can take this guide and write your own AI policy if you want, but really use it to guide the conversation among you and your leadership team on what is the questions that you need to answer. So let's kind of play pretend. So what we're going to do is Brett's going to walk me through the questions that are in that document around around scope, so that you can watch me flail through them. All right, Brett, go for it. My AI guide.
All right, Nabu. So you want to use this AI tool in your agency. Who in your agency is going to use this tool?
Well, I don't think my clinical staff should use it for clinical care, uh, but really anyone outside that should have access to um, AI tools. I'd like to get my staff at least an enterprise subscription to a safe AI tool, um, so that they can use it in their day-to-day work. So everyone but clinical people should be able to use it outside of clinical care.
Okay. All right. So that's an important distinction to remember. What about distinguishing different types of staff, so full-time, part-time, temporary, interns. Like who within those groups would be using the tool?
So, so I think that any sort of liability would apply to anyone that used AI tools in the course of their work with our department. So, yeah, I think it should apply to everybody,
Okay.
right? Yeah, everyone, all employees, full-time, part-time, contractors, and interns.
So everyone would potentially be using this AI tool.
Yeah, and I think like at the very least, I want the AI policy to cover everybody for sure.
Okay, fair point. You mentioned contractors, so assuming you have contractors, so if they're going to be using the tool, how are you going to enforce usage or proper usage of AI based on your policy with contractors and any external partners?
Um, okay. So all of them have contracts that cover um, like contract and data use agreements that cover their work with us. So I think now that you mention it, I should probably review our sort of standard terms and conditions and maybe work with our procurement and IT to see what if they have any standard language um, that should be included in contracts so that um, they can be they can be covered.
Okay. That sounds like a great idea.
Thanks, Brett. All right. So again, what I'm hoping you realize is like these are the sort of things that are important to work through. And then, all your departments have standard policy sections. Usually they begin with a scope. So depending on the answer to these questions, you write this policy applies to all staff except clinical. Clinical can't use it. All employees and contractors, and we will enforce this by incorporating contract language. Or if that's not important, just put the contract language in there. Y'all with me so far? Okay, so what I'd like to do next is go into breakout rooms to work through section 4 of this together. Each breakout room will have a facilitator, so it'll be either me or Brett or Anne or Kelly. But while I'm setting these up, does anyone have any questions?
I have one question
Yep.
that maybe we might answer at some point in time. I think one of the maybe concerns that I have about the process, I think certainly a policy needs to be created, but I think about the approval process. And so, for example, if I wanted to use AI to create a flyer for a program that I have, or something that's very minor, that isn't necessarily going to incur a lot of risk, I'm wondering if there are if you have suggestions or if we'll talk about certain approvals for certain things. So like if it's just kind of like basic, I'm trying to make sure that this is at a fifth grade reading level. That to me is a much less threatening thing than having AI analyze a data set for me and to, create some kinds of conclusions from that. And so I'm wondering if then all the kind of like menial, I don't want to call them menial, but like small task things that people use for AI, do we have to always have some like drawn out approval process, or is there a way to create like a blanket thing? Like if you're using it for this, then it's fine, but if not, then talk to somebody. And I think that that's where I'm getting hung up in terms of the process, is making sure that it doesn't become so cumbersome that people either don't use it or they circumvent these sort of policy rules that we're putting into place.
You're so right. That's absolutely yes. So you want to balance like bureaucracy with like ease of use, and but that's actually the exact purpose of like working through these questions, and like your policy document should get you that. So what like if you as a if you your organization's leadership team comes to the determination that we're okay with all our staff using ChatGPT and we're going to give them pro licenses from the organization as long as they only use it to draft um, what did you say it was? posters,
like a
or
flyer.
something?
Yeah, like a
A
flyer,
flyer.
or to make something at a fifth grade reading level, for example,
Yeah.
those types of things.
Right. So again, absolutely. And the policy can just say that. And what that does is it protects your organization for people that don't use it for the approved use, right? At the same time, the flip side of it is you want to be you want to make sure that you understand the risks and you work with your IT staff and your information security staff so that they are aware of the approved tools and the approved use cases as well, so that y'all are covered from a liability perspective. But Dan, it is a great, or I forget who asked that question. It is a great question, but that's exactly the purpose. And our hope is that this approach that we're giving you allows you the flexibility to do exactly that. And just so if that is the case, come to a decision as a group and spell it out, and then hopefully a lawyer looks at it to make sure you're okay as well. I hope that helps.
It does.
And
Thank
that's what I was going to pipe in and say. I know Andre has direct general counsel in-house. Most health departments do not, but that will be one of the important partners to have involved in the process is your legal counsel. And you may need to provide them with resources because this is probably one of a zillion things on their list, and AI may not be what they're most knowledgeable about.
Yeah. And if you don't have legal counsel, Network for Public Health Law, I know does do TA that is accessible to all health departments. If it is helpful, here is that resource that I was talking about. All right, one more question before we go into breakout rooms. I think that was Dan. Dan,
I got it.
Yeah.
Hey, I just want to address that last comment there. As we're in the process of going through this ourselves, one of the suggestions, the ways we're possibly looking at to address what the last person just said was to have general approval of whatever software it is, but then within that, leaving it up to the different we call them offices, but offices and programs of how they specifically want to use it. So for example, we would, I'm in the communications department at our health department, we would have just blanket approval to use it to help create text for social media posts, for example. And then we wouldn't have to, every time we do a post or use something off of that, get it approved. But also with the overarching concept that I think addresses a lot of this is that no matter where you get your information, you as the staff person are responsible for that information. So in the example that you had there where the different chatbots gave different example or different results, that's no different than if I just did a Google search on my own and started going through and looking for information. So I think that's where people get make it overly complicated. And yes, ChatGPT, whatever, could be wrong when it puts the information out, but so could you or anybody else if they're just looking at random stuff on the web and getting information. So it's tempting to take it the way it is, but I think as long as you make that clear to people and that they're responsible for it, I think that simple little statement can alleviate that, because you're right. I mean, everyone's research is up to them on the internet when they're trying to get information, whether it's through a chat process or whether it's just through random websites.
Absolutely. Dan, Brett, be quick because we do need to.
Yeah, I just want to distinguish real quick enforcement actions when you're when you're doing food code enforcement, that's not really an area where you're allowed to be wrong. So I would be careful about application and workflow you're talking about. Sometimes you could tolerate some of that being wrong, and other times you really can't. So I would just be real careful to consider the situation.
Awesome. All right, we're going to go into breakout rooms. When we come back, I will stay as long as y'all want for questions, okay? So your facilitators are Ann, myself, Brett, and Kelly, and we'll work through section 4 together. We'll come back around, at 45, which is very tight, but we'll do as best as we can. Almost certain that there was not enough time.
We got into the second of the 4 questions.
Hey, that's great. The point is that, let's work our way through these. And that you've had one stab at this away. So given the time, here's what I'm going to do. I'm gonna just go through the end of our presentation, and then we'll save time for questions. So key takeaways that I hope you got from this. AI can be a tremendously powerful tool. Approach AI policy from a place of possibility, not from saying no, but from saying yes. And that your policy should address scope, approval and access, ethics and privacy, training, and what the approved uses are across those 12 sort of sections of that document. That is a suggestion. It is not the Bible. Feel free to take that and use it. If you have any questions, you are welcome to contact me here. Another thing I want to sort of share is if folks are interested, we have an AI community of practice that meets the third Thursday, I believe, of every month. So we have one this week. Weirdly enough, it's going to be focusing on AI policy. So if you'd like to join, bring any questions you have to that. And then I'm going to turn it back over to Anne for final thoughts, and then we'll stay on as long as you need to have questions. So Anne, back to you.
Now I got to remember if I had notes for this page. I don't think I do. So
Right.
Wanted to let you know that, we will have, a copy of the tool that Nebu provided. We'll make that available, as well as any of the slides themselves. We'll make that available too. And if there's something about the accreditation learning community specifically you want to suggest or know, just reach out to me directly. So for example, if we want to dig further into this topic and include it as one of our activities in the 2026 calendar, let me know. We have that calendar just about done. So let me know if there's something you really strongly think we should include. And we'll see if we can work that in. So I'll turn it back to Nebu at this point to address questions and answers.
Awesome. Thank you so much. I really appreciate everyone joining. But in terms of takeaways, Andre Brown, if you're still on, I loved what you had to say about public benefit. Would you care to share that?
Sure. So we were sort of discussing what are the considerations that we would take into account in developing an AI policy. And one of the things that we've been sort of thinking about from our end is the public benefit. So how does AI help us to do our work better, achieve our mission, and ultimately improve the overall health of the communities that we're charged with serving? And really thinking about whether or not the use of AI either contributes to or in some ways maybe detracts away from that is one of those other considerations that we're thinking about on our end.
Thank you, Andre. I love that. I've not heard that before, and that is phenomenal. Dan, you had your hand up.
So funny. I got it from ChatGPT. Let me just say that.
Love it.
No,
Dan.
yeah, just before you get away, I just want to say shout out to Arlington Heights. I'm from Palatine, went to St. Viator High School.
Buffalo Grove, sir. Thank you.
All right, our arch enemies.
That's right.
No, but seriously, one thing that I see as an issue is that I'm sure most health departments are putting together a group or a team of people to kind of spitball on this, but there's different levels of understanding of AI and the issues and different thoughts on the best way to handle it. So I know that's a big one, but any thoughts on how to go about that? I'm personally leaning toward trying to make things simple, because you can go down a rabbit hole of something where you're never going to have a policy, right? Because you're going to, so what about it? What about this? What about that? What about that? And, by the time you come up with the policy, the robots have taken over, right? So, so I don't know if you have any thoughts on like trying to ground everybody with a base knowledge, and then, like someone mentioned, Adobe, and so I'm in communications. I'm thinking about, okay, what can communications do with it? But I understand all the specifics. Now, when there's other people on the committee who don't really know anything about Adobe or understand what can be done in there, it's hard for me to, I have to teach them how to use Adobe first before I can even get into the issues of what we're talking about, So I don't know what a good answer to that is, other than it's just a issue.
Great question. And so what we've seen over and over again is at some point, like the people that are making decisions oftentimes don't more often than don't understand these tools or think of it as essentially Google. And that's a problem. We just do need to reframe that and as so like I'll give you a great example. I work in communicable disease, and my staff came up to me one day and said, "We need to put out fentanyl test strips in the clubs." And I said, "Excuse me?" And so they said that like what is happening now is that folks are, doing fentanyl, and you can look at my face and I have no idea what fentanyl is. And so like it's one of those things where like public health more than anyone is constantly has to deal with new things, right? New diseases, new products, whatever. So we know how to do this and it's happened before. And that's why I'm saying like we need to take a harm reduction approach to AI. And the first step of that is like telling people it's an issue. So more than anything, the key thing to take away and tell your leadership is that your staff are using it and it's a liability. Like I guarantee you, even if it's banned, even if it's whatever, your staff are using it. So what keeps me up and what would keep me up at night if I was in a health department is an intern on a deadline putting in PHI into a ChatGPT instance or something for data analytics or whatever. We don't have a template on how to deal with that. And so we need to deal with this problem is the framework. In terms of the potential of the tools, that's an interesting conversation. And I think at some point that just have to be like one of the only things that I've seen work is that one of the health departments has like a AI lunch and learn where every like month someone presents a new AI tool and they try to like drum up um, interest in it organically. So that's one way to do it. But at the end of the day, we need to take the approach that we've always done, which is that like new things exist and we need to deal with it. Dan, I'm not certain that was a good answer, but it is the one I have.
Thank you.
That brings up one item we didn't talk about when we were on the second question around what are the criteria that are most important. We didn't talk about what types of data should or shouldn't be, and that might be an easy place for some health departments to start is specifically what data should we not be using AI with or should not be feeding to AI. That might be an easy place for some folks to start.
Absolutely. Any other questions? Oh, yes, Andre.
Sorry, I keep talking. I apologize, but this is very interesting and very timely for me. At our agency, I think one of the challenges with selling AI is that I think there is a belief among some people that people won't do their jobs. And so as opposed to seeing this as a kind of additive type of thing, it's sort of like you're just not gonna do your job and you're just gonna have ChatGPT do it or whatever. And I think that makes that belief makes it a hard sell for people, particularly folks who are in leadership, for example, who are charged with making sure people do their jobs, right? That then it won't supplant a human being. And so I'm wondering if there are any strategies that you all would suggest in terms of the PR side of this and getting buy-in, because I don't think everyone has bought into AI as like a thing that can help us do our jobs better. I think some people believe it's something that will allow us to do our jobs less, and then just have some mindless machine doing it. So that certainly is, I think, a sticking point a little bit for us, is that kind of mistrust, I guess, is the way that I would frame it.
It's a good question. Does anyone else have thoughts on that? I do, but I don't want to keep talking. Yes, Terry.
Sorry,
Terry?
I had to answer yes to that to use my mic. So from IT perspective, it's job security, right? You're introducing potential tools that could make efficiencies and maybe a need, it's like job security, right? Is where I'm coming from with it.
So it's like using AI tools will give you job security. Is that what I heard?
No, integrating, making things more efficient, replacing things with AI for coding or other things like that, could potentially reduce
absolutely.
or the need for folks or FT, right? Because you have a machine doing it.
Absolutely. Yeah, Katie?
Hi, yeah. This is also something that I worry about. I mean, we already have, most people at my department use ChatGPT and all that. So I kind of go back to, I talk about like our tone a lot as a health department, like how we want to sound to others and making sure that that tone is still staying the same. So regardless if you're using ChatGPT to like help you out with a social media caption or kind of go over an email for you, I really kind of drive home, we still want to be who we are because that's pretty important to the work we do. Again, I mean, I'm from a small rural health department. So it's just important, like the tone that we put out there and that's staying the same and it doesn't just sound like ChatGPT.
Absolutely. Daniel? Daniel?
Sorry about that. It took a second to kick on. I'll be brief. We just use the term augment when we discuss AI. We never want to remove the human element here in Trumbull County because you still have to vet a lot of that information and make sure it's accurate. So whenever we slowly use the term AI in our trainings and whatnot, we always say it augments what we currently do.
Absolutely. And so I will append my thoughts to this. It's that we use the term augmented intelligence as well. There's that classic thing of like, you won't get replaced by AI, you'll get replaced by someone that knows how to use AI. For public health, I think that we have the added context that we're constantly being asked to do more with less. And this would be one area where we can at least help take some of the administrative burden off of the backs of public health professionals so that they can use their brains to do what they're supposed to do. And the flip side of that too is our community is using this, which means that we're going to have more emails, more calls, more whatever, more asks for faster information from the community. So it's on us to make sure that we deliver services and meet people where they are in the way that they want to be, which right now does mean that we have to engage with these tools. And we have to absolutely acknowledge the uncertainty among our staffs that these tools are kind of scary. And both of those things can be true, right? Like we can't be impersonal there either. So there are none of these questions have easy answers. Our kind of thesis is it's here and we have to deal with it. And here's a framework for how to do that. So it's the top of the hour. I will stay on for as long as y'all want, but thank you so much for joining. And thank you, Anne, for inviting us to do this. It is such a pleasure to be able to talk to you for a second time. If you ever need to contact me, my email is nebu@fntlabs.com. I'll happily stay on, but thank you all for joining. And anything else to add before you say bye?
Oh,
Awesome.
thank you.
All right, Peggy. So if using AI for a public document, does it need to be acknowledged or sourced? This is a question we got the last time as well. So I would say yes. And we have not seen, I have yet to see a state or county level policy that says that. It is possible that they're out there. When I said yes, the last time this question was asked, someone said, well, if we say yes, then our community might not trust it. And so that local context is important. So like we don't say I used spell check when drafting this document, right? So like there is a line. I think it's community by community. So I think like some people might appreciate that, some people might like turn it away. So it is, I don't think there is does it have to be? I have yet to see a policy that says it has to be, but slowly I'm certain that PubMed and all these journals will have a policy that says you have to cite AI as like a writing companion or research companion, stuff like that. So I think we'll slowly start seeing more of that. But right now, I don't have an answer. Anyone else?
I know I just read something recently talking about that whole trust issue with the public, and maybe one way of helping mitigate that is to emphasize the human in the loop part so that they understand, or, you can say, yes, we use this to help us be more efficient. However, we always have a staff member and, a subject matter expert, whatever is the right term, review this before we issue it. Um, so maybe that is a way to help bridge that, you're acknowledging use, but you're also informing the public about how are you making sure the information is as accurate as possible.
I love that. Any other questions? Thanks, Shireen. All right, hearing no other questions, thank you so much for all the wonderful discussion and for all the work that you do. Public health matters. You guys save lives. So thanks all, and please don't hesitate to reach out if you have any questions.